Welcome to this week's Health and Care update on the coronavirus pandemic in Devon. While cases here in Devon are falling overall, we are seeing a small increase in mid-Devon. This is a helpful reminder to us all, I think, that we can't drop our guard and we need to continue to be doing the public health measures. And I'd like to hand over to my colleague Simon Chant, who will be able to go through the data in more detail.
This is an overview of the latest national and local data on COVID-19 as of Thursday, the 11th of February. We start with the national picture. Cases are falling nationally. The number of tests remains high due to the increased local testing capacity. Deaths remain high, but numbers are now falling. Now for the local picture. In Devon, for the latest available week, there were 475 COVID-19 cases and 24 deaths, with rates of both below the national average. Case rates are slightly higher in mid-Devon. Cases of COVID-19 are continuing to fall in Devon, although cases and deaths are still above the levels seen in the autumn. Case rates are currently highest for those aged 20 to 39, but are falling in all age groups, and most rapidly in those aged 80 and over. The data in this summary is drawn from Devon's COVID-19 dashboard and the National Coronavirus Tracker, where the latest available information can be found.
Thanks, Simon. As you can see from the data, many of our cases are in the working age population, and we are still seeing some outbreaks in workplaces. So please don't get complacent and don't drop your guard, either in the workplace or indeed travelling to or from work. Please continue to follow the national lockdown restrictions. Stay at home and only go out if it's absolutely essential. And if you do go out, remember, social distance, wear your face coverings indoors, and remember to wash your hands regularly and thoroughly. And I'd like to hand over to Dr. Paul Johnson from NHS Devon CCG.
We've seen a reduction in the number of people in hospital with coronavirus over the past week, which is great news. And it's thanks to your dedication in continuing to follow social distancing. Although the figures have fallen, they are still more people in hospital than there were in December. So we can't take our foot off the gas yet. Remember, it's the little things like maintaining social distancing, washing your hands regularly and wearing a mask in public, even if you've had a vaccine, that will make the big difference. Health and care staff, volunteers and local charities across the county have pulled out all the stops to vaccinate local people. And as a result, we're on track to meet our goal of offering everyone in the top 4 priority groups a vaccine by mid-February. So far, we've vaccinated more than 200,000 local people, including more than 90% of those aged 80 and over. The vaccine is vital for saving lives and for giving us a way out of this pandemic. And it's really important that as many people as possible get vaccinated. To make sure everyone in the top 4 priority groups is offered the vaccine, the Secretary of State for Health and Social Care, Matt Hancock, has encouraged anyone over 70 who has not yet been vaccinated to get in touch with the NHS about booking an appointment. There are 2 main ways you can do this. Firstly, use the National Booking Service, and the simplest way of using the service is to book online. But if you can't book online, you can call 119 between 7 in the morning and 11 at night, 7 days a week. You don't need to have received a letter or know your NHS number to use this service, and the system will allow you to choose a time slot and a location that suits you. It offers appointments at large vaccination centres or the selected community pharmacies that are offering the jab. Or you can contact your GP practice. Across Devon, we've got 20 GP-led centres in operation, serving all 123 of our county's GP practices. And if you are in one of the top 4 national priority groups and haven't yet been contacted to arrange a vaccine, you can contact your practice. However, if you can wait, particularly if you're in the 4th priority group, age 70 to 74 or clinically extremely vulnerable, then please do wait, as this keeps the GP phone lines available for people who need medical attention, and your GP practice will contact you very shortly. However, if you are concerned that your contact details may not be up to date or you've been missed, then please do contact your GP practice to check. GP-led vaccination sites book appointments depending on how much vaccine they are sent from the national supply chain. Once these appointments are full, practices wait until they are notified of their next delivery before booking appointments. And because practices have efficient processes for contacting patients to fill up their appointments and avoid wastage, they are unlikely to have empty slots when you call them. Some practices are posting helpful updates on social media or on their websites to let patients know whether slots are available or not, so people can avoid unnecessary calls, so please do check there. And when attending any vaccine appointment, please arrive no more than 15 minutes before to avoid any unnecessary queuing. Wear warm clothes when the weather is cold. So our message to you is, if you are over 70, please do book an appointment to get a vaccination. The vaccine is safe, it's simple, and it'll offer you and those around you crucial protection against this virus.